Tension releaser works by mimicking suboccipital release technique, which is a technique that is very popular and widely used by massage therapists, physical therapists, and chiropractors to treat tension headaches. And what it is, it's basically a deep tissue massage in these muscles under your occiput, right, at the back of your skull. And the reason that works so well to treat tension headaches is because running through those muscles, penetrating those muscles, you have arteries, veins, lymph vessels, nerves. They penetrate through those muscles, then they wrap around your head, and they end up like behind your eye or by the temple. And when those muscles tense up and they squeeze on those vessels, you end up feeling the pain downstream. There's also another phenomenon known as referred pain, and that is basically when you have an issue in one area of the body but you feel it somewhere else. That has more to do with the way that our nerves are wired in the brainstem, in our spinal cord. You can trigger a muscle back here, and when as it's sending this pain signal to your brain thinks that the pain is coming up here. So you have those two different theories, right? That you have vessels, arteries, lymph nodes being squeezed, and you feel all the pain downstream, and then you have referred pain. Nevertheless, we know that when we can relax or release the suboccipital muscles, you feel a lot of relaxation and relief of the symptoms downstream. And so what we do is we take our fingers. I'm a chiropractor, and if you go to a massage therapist and you tell them you get headaches, this is what they're going to do. They're going to have you lay on your back, and they're going to dig their fingers into these muscles. And if you're having a true tension headache versus like a cluster headache or a migraine, you're getting, most of the time, 95% of the time, you will feel relief of your symptoms. And so tension releaser mimics that exact treatment, right? You lay on it here, and the knobs here are like the two fingers digging into your muscles. And the knobs, by the way, are adjustable to fit your specific neck size. You can adjust them side to side. And if the knobs by themselves are too painful or too pointy, you can use these blue caps to help dissipate the pressure. But just to let you guys know, tension releaser applies a very aggressive and sometimes painful treatment. It's very painful, but it's more of a good hurt. People describe it as a good hurt. It feels good, or it hurts so good. If you're the type of person that doesn't like deep tissue massage, or you are very pain intolerant or very sensitive to massages, this is probably not going to work for you, so don't buy it. But if you are the type of person that you're always asking your partner or your kids to dig their elbows into your back or your neck, and when you go get a massage, you always go for the super aggressive deep tissue treatment, this is gonna work for you. This is gonna work really well. And so what we have here is basically just a platform. Your back goes on this part to keep it from rocking or sliding out of place. I want to show you guys some of the different products that are out on the market. You can find these online on Amazon or Google. You lay on them and they push on your occiput, but the problem with these is that they either will rock out of place or they'll slide out of place. They won't stay put, and they're not adjustable, so you can't adjust like the width of these knobs. And so what I've learned through my practice, I used to own a chiropractic clinic, and I only treated tension headaches. That was like my specialty. And in fact, the name of my practice was Headache Relief Chiropractic and Massage, and that's all we would treat. And I would do stretching, a suboccipital release, aromatherapy, chiropractic adjustments, and all that. And the only thing, like the one thing that made all the difference was the suboccipital release. So I thought there's got to be a way for patients to be able to do this on their own, because as a chiropractor, as a practitioner, I'm always having to check in with my patient. How's the pressure? Is it too much? Too little? How's the location? Should I go out to the side? Am I in the right spot? And so you can't really do that to yourself, like with your fingers, because it's not relaxing. So I developed tension releasers so that you can control the pressure in those muscles, and you can adjust and control the location of where you're applying the pressure, and you don't have to rely on someone else to do it for you. And it's a one-time payment. So instead of having to go into the massage therapist all the time for like a $60 massage or going into the chiropractor for a treatment, This is just a one-time payment and you can use it forever. And it works really well. If you watch the reviews, those are all legit. We also have a 90-day return policy, so you can try it out, and if it doesn't work, you can just send it back to us and we'll refund every penny. So if you suffer from true tension headaches versus like cluster headaches or migraines, however, suboccipital release does also help like 50% of migraine patients, because there's a lot of overlap, right, with like stress, tension, and migraines. And so if it's not a true tension headache, but it's more of a migraine, this might actually help. But if you know for sure that it's a tension headache or like a stress related headache, there's a very, very good chance this is going to work, especially if you are pain tolerant and you crave that deep tissue massage. So give it a try, and if you guys have any questions, feel free to email us. You can find our email at the bottom of the page. It's thechiropracticfix@gmail.com, and we'll get back to you as soon as possible. Thank you so much for your time.